Well, you may know that tune as a little precursor to what's about to come here on WJER. They are the Thompson twins. They are not doctors, but we have the doctors in the house here for Medical Minutes. Welcome back again from Cleveland Clinic Union Hospital, Dr. Thomas Rogers, and guest. Happy Monday afternoon before Turkey Day. Dr.
Yes.
Rogers, thanks for making time for us today.
Oh, Kelly, thanks for having us. It's exciting to be here. Happy Thanksgiving to you as well.
Thank you.
What a great week. And it is Diabetes Awareness Month, so we really wanted to close out the month. November was Diabetes Awareness Month, so we're almost through November. But we wanted to bring one of our caregivers who we've not had on before. In fact, we haven't even had a physician assistant on before, so it's a really cool day today. Ethan Meyer is here, he's one of our PAs, who's a graduate of Millersburg West Holmes, so really cool. And then went through Toledo through his PA program, and was married recently, about 4 months ago, and lives here in Dover with his wife, so we're excited. He's been with Cleveland Clinic just since 2023, but works up here at the North Pod and sees all the patients that we want him to see across the board. He can see everybody, and so one of the things is he does a great job with patients with diabetes, so we really wanted to highlight him today, and that's why Ethan is here today.
Oh, Dr. Rogers, what a great selection of all the staff you have that have been on the air. Ethan, welcome to WJER. When did you quickly first know you pretty much wanted to become a physician's assistant?
It actually took me a while into school. My college career actually was going to be a physical therapist for a while, and then I wanted to be a teacher for a while, but then couldn't really settle on either of those, and decided physician assistant would be a good fit for me. So
Now, I do not call you Dr. Ethan, though, correct?
correct, just Ethan.
Okay, all right. Well, we all know better. It's not just Ethan. And really, you're dealing with physical therapy and teaching when you're dealing with, especially a newly diagnosed diabetic. Ethan, what are the different types of diabetes?
Yeah, so the most common ones that we see are, we all think of type 2 diabetes, which is, usually an issue with, your body just can't handle the sugars that are being, over time, however much sugars you have, just a little bit more than your body's able to handle. There's also type 1 diabetes, which is more of an issue with your body secreting insulin, which is what helps your body process those sugars. So in type 1 diabetes, you just aren't creating enough insulin to handle the sugars. And then there's gestational diabetes too, which is similar to type 1 diabetes in that your body can't handle the sugars or the amount of new sugar that is being introduced from the metabolic demands of the pregnancy.
Now, would gestational diabetes resolve back to normalcy after delivery, perhaps?
It normally does. It does carry an increased chance of diabetes for the mother and the baby, though, moving forward in their life.
Okay, so a good idea to keep it monitored all the time. Again, we are on the air with Medical Minutes, Dr. Rogers, and Ethan, the physician's assistant from Cleveland Clinic Union Hospital in Dover. What about the symptoms? It's National Diabetes Awareness Month, family gatherings, Friendsgiving coming up here. Good time to talk about the symptoms and what are the major 3 or 4?
Yeah, so actually a lot of the time there are no symptoms. It's just found on routine screening. When it is symptomatic, it's usually because the sugars are very uncontrolled. Those tend to be things like increased urination, increased thirst, and weight loss are actually the big 3 that can happen acutely. And that's usually due to your body is trying to excrete the sugar through your urine, so you're drinking more water, and then with the increased metabolism, your body, you actually lose weight, which is kind of interesting.
Not even trying to lose
Correct.
weight.
Yes.
And that thirst, unsatiable. It's just like every 10 minutes you just cannot get enough water or
Right.
something to drink. Well, now, Ethan, what about the long-term complications? You can't ignore these symptoms. So,
Right.
I mean, call yesterday if you got any of those
Correct.
symptoms. What are the long-term complications of diabetes? Why is it so dangerous?
Yeah, so it increases, it just puts your body in a state of increased inflammation moving forward. So that can cause things such as, it increases risks of heart attacks, increases risk of stroke. It can cause, nerve damage, which can cause really bad pain. Moving forward, that can be hard to treat. It can cause kidney damage. It can cause eye issues, so it can lead to blindness. Really just can be really, really detrimental on quality of life the longer it's uncontrolled.
And we're talking even younger ages with some of those complications. And is the glucose molecule, do I understand, sticky, clumps together, and that's what's clogging up those tiny capillaries and veins? They're not getting the proper oxygen and nutrition.
That's
because of the high blood sugar.
Yeah, and it makes your arteries and veins stiffer too. So they're just not as elastic as they should be, which again makes it easier for things to get in there and stick.
Okay, so bring us up to date. 2024, almost to the end of Diabetes Awareness Month. Make us aware of how you manage it today.
Yeah, so there's actually a lot of great new medications out there. The most common names that a lot of people have probably heard are Ozempic, Mounjaro are the big two that we use commonly. They work by, they are similar to a natural hormone that is released by your stomach. And they do things like they make you feel more full, so you don't need to eat as much. They make your body secrete more insulin. They can make your body, it slows down how fast your body can process food sometimes, so it stops your sugars from spiking quite as much too, which can be really, really beneficial too.
Wow, amazing how they can work. But again, just taking an injection or a pill, that's not the end of the story. You need a complete nutrition exercise picture to be healthy, no matter diabetes or no.
Correct. Yeah, the best thing you can do for diabetes is lifestyle changes. So things like watching your diet, especially carbohydrates or sugars or sweets or anything like that, and then increasing the amount of exercise you're doing too. That's the best thing you can do long term for diabetes.
Ethan Meyer, physician's assistant with the Cleveland Clinic Union Hospital. Before we wrap up today's medical minutes, what about the prevention side and the prognosis?
Yeah, so prevention, again, it goes along with the best treatment for it, which is make sure you're eating well and getting a lot of exercise. Those are the best two things you can do for preventing it in the future. You want to try and keep your weight under control because increased weight just makes it harder for your body to deal with that kind of stuff. And then the prognosis of diabetes really depends on how well it's treated, how well we keep the sugars under control. If you keep them under control long term, you still need to monitor things, but the prognosis is much better than if they're uncontrolled for years and years and years. That's what's really scary and can lead to all those complications we talked about before.
Mm-hmm. Ethan Meyer, again, physician's assistant. I have one more from the psychological standpoint. I've been dealing with type 1 myself for years. Here come the holidays. The beautiful food, the platters, the trays. Psychologically, do you have any tips? Remember your Psych 101 classes for me for a moment. Are there any tricks or tips on how to, stay strong, stick to maybe a little bite here and there? It's not going to hurt things too much, but give me some psychological strength for the holidays, Ethan.
Yeah, and I always tell people when I'm talking about diabetes, you can certainly have indulgent sweets and carbs and stuff, especially in the holidays. The best thing is moderation. You don't want to just eat those all the time. So that, and then talking it over with other people who have diabetes, who have been through similar things, or family members who can help keep you accountable when you're struggling with days where the pumpkin pie and mashed potatoes look extra good. So
they really are. And again, Ethan and Dr. Rogers, now we're in a time a blessed time where there is an online community. You know, I never grew up with that back in the 70s, 80s, and now you can hop online to someone over in London who's dealing with the very specific same things: male, female, type 1, type 2. You know, that online community, I'm sure, is helpful to you and all of your patients. Ethan Meyer, thank you so much. We've only scratched the surface today, right, about
Right,
diabetes,
right.
but it is National Diabetes Awareness Month, and Dr. Rogers will finish up with you here today. If we do have any questions, or we think we may have someone in the family or at the office who presenting some of these symptoms, they'd like to get in touch with you, what should we do?
Yeah, absolutely. Really, your PCM, your primary care doctor or PA or nurse practitioner, whoever you have, is best to be able to make appointments with them. Or for unionhospital.org, you can also go online and make appointments. But we absolutely want to be able to get you on. This is such a primary care issue that we really need to be able to have that cooperative effort between our docs and our PAs and our nurse practitioners with the patients. And the thing is, just come in and see us and we'll talk to you about it. That's the best way.
Great. And again, right here in Dover, Ohio, some fabulous resources. And Dr. Rogers, I have to say something about the Werther's crew and the long-running Christmas Tree Festival. Why don't you remind our listeners what happened? It just wrapped up. Did you make it?
It did. I did make it this year. Again, it's such a great event every year. So if you did not get a chance to attend this year, please come next year. It's usually about 2 weeks or about 10, 15 days before Thanksgiving. It is such a great event. The wonderful trees and all the things that are made by our auxiliary, and all that goes right back to the hospital, which is such a great event. And the community that comes out and supports it. So just a wonderful event, and it did just wrap up. I've got to go back and pick up a couple trees tomorrow night. So, but it is such a great event. We did have a wonderful time there. So the Friday night event is just incredible. But all week you go and see the trees. They just wrapped up yesterday, but certainly next year you can. But it kicks off the holiday season such in a great way. So.
And $5 still?
$5, that's it. And you get the double, be able to see all the Werther, all the from the museum itself, behind all the trees and stuff. You can still see them all. But $5, that's it. And I think if you're a union caregiver, it's free for one person. So it's pretty cool.
Oh,
Great
well,
thing.
Thank you for saying something to all the volunteers who made that beautiful, breathtaking Christmas Tree Festival happen. You know, it's fun to see the event during the daytime, but then the lights are out, it's dark out, it has a whole different ambiance when you go at nighttime as well. So Dr. Thomas Rogers, thank you so much. Thank you to the auxiliary and all the volunteers who made the Christmas Tree Festival happen. Thank you to the Werther's crew for allowing that on their grounds and in the museum again this year. Thank you. Physician's assistant, we have so many great questions from the listeners. I can smell it. Ethan Meyer and Dr. Thomas Rogers, thank you so much for National Diabetes Awareness Month information on today's Medical Minutes. We really appreciate your time.
Thanks, Colin.
Thanks,
Thank you
Kelly.
so much.